All right, guys, let's go ahead and get started. So we're going to start with the study guide questions from chapter 3. And you're just going to be doing the even number questions. Excuse me. Okay. Number 2 is false. Number 4 is true. Number 6 is false. Number 8 is true. And 10 is true.
I'm sorry.
Go
What
ahead.
page are we on?
We are doing the chapter 3 study guide questions. We're going to grade those, and then we're going to start on chapter 4, which is on page 87.
Oh my goodness.
All right, so on the post test on chapter 3, number 2 is false. Number 4 is false. Number 6 is true. 8 is true. 10 is true. Key term assessments. 2 is E for elephant. 4 is J for jump. 6 is A for apple. 8 is C for cat. 10 is L for Lucy. 12 is D for dog. And 14 is B for boy. All right, evaluation of learning. Again, I'm going to give you the answers. If you are close to everything on the answers, then you'll mark it correct. Otherwise, you'll mark it wrong. Number 2 is botulism and tetanus. Number 4, to ensure that employees are informed of the hazards associated with chemicals in their workplace and the precautions to take to protect themselves when working with hazardous chemicals. Number 6, it is an international standard that provides consistency in the classification and labeling of chemicals through the use of pictograms, signal words, and hazard warnings. 8, product identifier, supplier identification, GHS signal word, GHS hazard statements, GAS hazard pictograms, GHS precautionary statements, and supplementary information. Number 10, danger denotes a more severe hazard possible. Warning denotes a less serious hazard possible, but potentially harmful. Number 12, hazard pictograms consist of standardized graphic symbols that allow employees to quickly identify the types of hazards associated with a hazardous chemical. Number 14, to remove organic matter from an article and to reduce the number of microorganisms to a safe level. 16, to protect the individual from bloodborne pathogens and other potential infectious materials, and to protect the hands from the irritating effects of chemical agents and accidental punctures or cuts from sharp instruments. 18. Chemicals have a tendency to lose their potency over time. 20. Surface of an instrument, steel, nylon brush. Grooves, crevices, or serrations, stainless steel wire brush. 22. Makes an instrument function better and last longer. 24. An item requiring high-level disinfection is a flexible fiber optic semiscope. A high-level disinfectant is a glutaraldehyde. 26. Examining tables, laboratory countertops, walls. 28. Organic matter prevents the chemical disinfectant from reaching the surface of an article to kill microorganisms. 30. To destroy all forms of microbial life. 32. It allows a higher temperature to be obtained than could be reached by the steam from boiling water alone. 34. Temperature 250 degrees Fahrenheit. Pressure is at 15 psi. 36. Determines the effectiveness of the sterilization procedure and checks against improper wrapping of articles, improper loading of the autoclave, or faulty operation of the autoclave. 38. In a cool, dry area. 40. In the center of the wrapped pack with the end containing the dye placed in an area of the pack considered to be the hardest for steam to penetrate. 42. To protect them from recontamination during handling and storage. 44. Sterilization paper, disposable and inexpensive. Sterilization pouches provide good visibility of the contents, usually include a sterilization indicator. Muslin, economical because it can be reused, lies flat when opened. 46. Small packs within 1 to 3 inches between them. Large packs with 2 to 4 inches between them. Jars and glassware on their sides with their lids removed. Sterilization pouches on their side or with the paper side up and the plastic side down. 48. Depends on the type of item being autoclaved. 50. A sterile pack is considered sterile unless an event occurs that interferes with the sterility of the article, such as crushing, compressing, or dropping the pack. 52. The outside of the autoclave should be wiped with a damp cloth or mild detergent. The interior of the autoclave trays and rubber gaskets should be wiped with a damp cloth. The rubber door gasket should be inspected for possible damage that could prevent a good seal. 54. It dulls their sharp points or edges. And 55. Only chemicals designated as sterilants by the Environmental Protection Agency can be used for sterilizing articles. The items to be sterilized must be submerged in a chemical for 6 to 24 hours each time a new instrument is added to the container, the clock must be restarted and the batch processed for a full amount of time. Cold sterilization should be used only when sterilization with steam, gas, or a dry heat oven is not indicated or the required equipment is unavailable. Okay, so make sure you let me know how many you missed or if you missed any. And you can do that now or whenever we get through with live lecture. Okay, so very good. So let's turn to chapter 4 in our books on page 87. Introduction to vital signs. All right, let's see. Alexis, can you go ahead and read Introduction to Vital Signs?
Did you say Anna?
Alexis.
I had it on mute. Sorry.
That's okay.
Vital signs are objective guideposts that provide data to determine a person's state of health. Vital signs include temperature, pulse, respiration, collectively called CPR, and blood pressure. Another indicator of a patient's health status is pulse oximetry. Although some providers order this measurement routinely for all patients as part of the patient's workup, most providers order measures of this vital sign um, only when the patient complains of respiratory problems. The normal ranges of the vital signs are finely adjusted, and any uh, deviation from
Yep.
deviation from normal may indicate disease. During the course of an illness, variations in the vital signs may occur. The medical assistant should be alert to any significant changes and report them to the provider because they indicate a change in the patient's condition. When patient when patient visits the medical office, vital signs are routinely checked to establish each patient's usual state of health and to establish baseline measurements against which future measurements can be compared. The medical assistant should have a thorough knowledge of the vital signs and should attain proficiency
Mhm.
in taking them to ensure accurate findings.
Okay, stop right there for me. All right, so on page 87, you're going to highlight the first sentence, the second sentence, and the third sentence. Okay, Alexis, go ahead and finish on page 88. We're above temperature. Go ahead and finish the rest of that.
Okay. General guidelines that the medical assistant should follow when measuring the vital signs are as follows. Be familiar with the normal ranges for all vital signs. Keep in mind that normal ranges vary based on different age groups: infant, child, adult, elder. Make sure that all equipment for measuring vital signs is proper working condition to ensure accurate findings. Eliminate or minimize factors that affect the vital signs such as exercise, food, and beverage consumptions, smoking, and emotional state. Use an organized approach when measuring the vital signs. If all the vital signs are ordered, they usually measured starting with temperature followed by pulse, respiration, blood pressure, and pulse oximetry.
Very good. You're going to want to highlight number 1, 2, 3, and 4. Temperature, regulation of body temperature. Body temperature is maintained within a fairly constant range by the hypothalamus, which is located in the brain. The hypothalamus functions as the body's thermostat. Highlight that sentence. It normally allows the body temperature vary by only about 1 to 2 degrees Fahrenheit throughout the day. Body temperature is maintained through a balance of heat produced in the body and the heat lost from the body. A constant temperature range must be maintained for the body to function properly. When minor changes in the temperature of the body occur, the hypothalamus senses this and makes adjustment as necessary to ensure that the body temperature stays within a normal and safe range. If an individual is playing tennis on a hot day, the body's heat cooling mechanism is activated to remove excess heat from the body through perspiration. Heat production.
What do we have?
Just the second sentence where it says the hypothalamus functions as the body's thermostat.
Okay.
All right. Alicia, go ahead and read heat production.
Most of the heat used in the body is voluntary and involuntary muscle contractions. Voluntary muscle contractions involve the muscles over which a person has control, for example, the moving of legs and arms. Involuntary muscle contractions involve the muscles over which a person has no control. Examples are psychological processes such as digestion, the beating of the heart, and shivering. Body heat also is produced by cell metabolism. Heat is produced when nutrients are broken down in the cells. Fever and strong emotional states can also increase the heat production in the body.
Very good. You're going to want to highlight the very first sentence on heat production. Anna, will you go ahead and read heat loss?
Heat is lost from the body through the urine, feces, and water vapor during exhalation. Perspiration also contributes to the heat loss. Perspiration is the excretion of moisture through the pores of the skin. When the moisture evaporates, heat is released and the body is cool. You may read all of it?
Yes, please.
Radiation conditions and convection all causes loss of the heat from the body. Radiation is the transfer of the heat in the form of waves. Body heat is continuously radiating into cooler surroundings. Conduction is the transfer of heat from one object to another by direct contact. Heat can be transferred by conduction from the body to a cooler object is touches. I'm sorry, I'm like trying to like keep my son from touching the phone too.
That's okay.
Convection is the transfer of the heat through air currents. Cool air currents can cause the body to lose heat. These processes are illustrated in figure 4.2.
All right, very good. Okay, you guys are going to highlight the meanings of radiation, conduction, and convection. All right. Danae, can you go ahead and read body temperature range?
The purposes of measuring body temperature are to establish the patient's baseline temperature and to monitor an abnormally high or low body temperature. The normal body temperature range is 97 to 99. The average temperature being 98.6 degrees Fahrenheit. Body temperature is usually documented using the Fahrenheit system of measurement. Table 4.1 lists comparable Fahrenheit and Celsius temperatures and explains how to convert temperatures from one scale to the other.
All right, very good. So on body temperature range, you're going to want to highlight where it says the body temperature range is 97 degrees Fahrenheit to 99 degrees, and the average temperature being 98.6 degrees Fahrenheit. All right, Jasmine, go ahead and read the alterations in body temperature.
Alterations in body temperature. A body temperature greater than 100.4 degrees Fahrenheit and 38 degrees Celsius indicates a fever or how would you say that? Pyrexia. If the body temperature falls between 99 and 100.4, this is called a low-grade fever. When an individual has a fever that the heat the body is producing is greater than the heat the body is losing. A temperature reading greater than 105.8 is known as hyperexia.
Yes.
Hyperexia is the serious condition and a temperature greater than 109.4 is generally fatal. A body temperature less than 97 is classified as subnormal or hypothermia. This means the heat the body is losing is greater than the heat it is producing. A person usually cannot survive with a temperature below 93.2. Terms used to describe alternations in the body temperature are illustrated in figure 4.
Very good. Okay. So for the alterations in body temperature, you are going to want to highlight the very first sentence. And highlight where it says that hyperpyrexia is a serious condition and a temperature greater than 109.4 degrees is generally fatal. Highlight the next sentence. A body temperature less than 97 degrees Fahrenheit is classified as subnormal or hypothermia. And highlight where it says a person usually cannot survive with a temperature below 93.2 degrees.
I have a question.
Yes, ma'am.
So since your body can be above 109, does that mean like you can get brain damage if your body gets too hot?
Yes, not only will it cause damage to the brain, but it causes damage to the organs as well.
And that's when all your organs start and stuff.
Yeah, yeah. So if you ever seen, have any of you guys ever watched things like Grey's Anatomy or ER? Any shows like that?
Yes.
Okay, have you ever seen them on some of the patients where they start adding ice packs to the body?
Yes, and like cooling blanket.
Yes, cooling blankets. That's all ways to lower the temperature, because if our body temperature is greater, then that means our body is basically overfighting, right? It's causing too much heat and the body can't cool it back down. So we need to help it. If a body temperature either gets too high or too low, it will cause damage to not only the brain, but it causes damage to your organs. And that damage may not be reversible. All right, good question. Okay, so figure 4.2 is kind of like a little picture that shows what radiation, conduction, and convection is. And then table 4.1 is equivalent Fahrenheit and Celsius temperatures, and it also gives you a temperature conversion. All right, variations in body temperature. During the day-to-day activities of an individual, normal body temperature may fluctuate. The body temperature rarely stays the same throughout the course of the day. The medical assistant should take the following points into consideration when evaluating a person's temperature. Number 1, age. Jasmine, will you go ahead and read number 1, please?
Age. Infants and young children normally have a higher body temperature than adults because their thermoregulatory system is not yet fully established. Elderly individuals usually have a lower body temperature owing to factors such as loss of substantious fat, lack of exercise, and loss of thermoregulatory control. Shows the normal ranges of body temperature according to age group.
All right, very good. So you are going to want to highlight numbers 1, 2, 3, 4, 5, 6, and 7. And then I want you guys to make sure that you look at the figure 4.3 and the table 4.2. All right. Lily, go ahead and read number 2, please.
Diurnal variation. During sleep, body metabolism slows down, as do muscle contractions. The body's temperature is lowest in the morning before metabolism and muscle contractions begin increasing.
Very good, thank you. Nancy, read number 4, please.
Are we skipping number 3 or did I miss number 3?
Oh, I'm sorry, number 3.
All right. Emotional states. Strong emotions such as extreme anger and crying can increase the body temperature. This is important to consider when working with young children who frequently cry during examination procedures or when they are ill.
Very good, thank you. Natalie, read number 4.
Environment. Cold weather tends to decrease the body temperature, where areas hot weather increases it.
Very good. Sabrina, number 5.
Exercise. Vigorous physical exercise causes an increase in voluntary muscle contractions, which elevates the body temperature.
Very good. Talia, read number 6, please.
Patients normally body temperature. Some patients normally run a low or high temperature. The medical assistant should review the patient's past vital signs documentaries.
Very good. All right, Alexis, go ahead and finish number 7.
Pregnancy. Cell metabolism increases during pregnancy, and this evaluates body temperature.
Very good. Okay, any questions on that? So it's basically kind of telling us that certain things that we do can either lower or raise our body's natural temperature. So especially if you're working in your pediatrics or your geriatrics, your elderly. Pediatrics, if your patient's crying, their temperature is going to be higher. And so that's why usually if we're going in order of our vital signs, temperature is the first thing that we do. And with our elderly, it's the opposite. They tend to be a little cooler. All right. Any questions on that? All right, very good. Alicia, go ahead and read fever, please.
Fever. Fever or pyrexia denotes that a patient's temperature has increased to higher than 100.4. An individual who has a fever is said to be febrile. One who does not have a fever is afebrile. Fever is a common symptom of illness, particularly inflammation and infection. When there's an infection in the body, the invading pathogen functions as a pyrogen, which is a substance that produces fever. Pyrogens reset the hypothalamus, causing the body temperature to increase to above normal. Fever is not an illness itself, but rather a sign that the body may have an infection. Most fevers are self-limited, that is, the body temperature returns to normal after the disease process is complete.
Very good. Thank you. Okay, I want you to highlight where it says an individual who has a fever is said to be febrile. All right, Anna, go ahead and read under the stages of fever. If you will read number 1.
A fever can divide into the following 3 stages. The one set is the temperature first begins to increase. If this increase may be slow or sudden, the patient often experiences coldness and chills, and the pulse and respiratory rate increases.
Very good. Danae, number 2, please.
During the course of a fever, the temperature rises and falls in one of the following 3 fever patterns: continuous, intermittent,
Mm-hmm.
or remittent.
Mm-hmm.
Fever patterns continue. Oh, I just read that. Fever patterns are described and illustrated in Table 4.3. During this stage, the patient has an increased pulse and respiratory rate and feels warm to the touch. The patient also may experience one or more of the following: flushed appearance, increased thirst, loss of appetite, headache, and malaise.
Malaise.
Malaise. Malaise refers to a vague sense of body discomfort, weakness, and fatigue.
All right, very good. So on number 2, you're going to highlight where it says during this stage, the patient has increased pulse and respiratory rate and feels warm to the touch. You're going to also highlight flushed appearance, increased thirst, loss of appetite, headache, and malaise. And malaise refers to a vague sense of body discomfort, weakness, and fatigue. Jasmine, go ahead and read number 3, please.
During the subsiding stage, the temperature returns to normal. It can return to normal gradually or suddenly, known as a crisis. As the body temperature is returning to normal, the patient usually perspires and may become dehydrated.
Very good. So for number 3, you're going to highlight where it says usually perspires and may become dehydrated. So you do need to know that there are 3 stages of fever: the onset, course of a fever, and subsiding stage. Okay, so now on page 91, on table 4.3, I want you guys to highlight the continuous fever under pattern and the description, and highlight remittent fever and the description. I want you guys to make note that dirty probes can cause a low temperature.
Repeat that again.
Dirty probes can cause a low temperature. Okay, the assessment of body temperature, assessment sites. There are 5 sites for measuring body temperature: mouth, axilla, rectum, ear, and forehead. Highlight that first sentence. The locations in which temperatures are taken should have an abundant blood supply so that the temperature of the entire body is obtained, not the temperature of the only part of the body. In addition, the site must be as close as possible to prevent an air current from interfering with the temperature reading. The site chosen for measuring a patient's temperature depends on a patient's age, condition, and site of consciousness, the type of thermometer available, and the medical office policy. Oral temperature. The oral method is a convenient and one of the most common means for measuring body temperature. When the medical assistant documents a temperature, the provider assumes it has been taken through the oral route, unless otherwise noted. There is a rich blood supply under the tongue in the area on either side of the frenulum linguae. The thermometer should be placed in this area to obtain the most accurate reading. The patient must keep the mouth closed during the procedure to provide a closed space for the thermometer. Highlight the sentence where it says there is a rich blood supply under the tongue in the area on either side of the frenulum ligae. Axillary temperature. The axilla is recommended as a site for measuring temperature in toddlers and preschoolers. Highlight that sentence. The axillary site also should be used for mouth breathing patients and for patients with oral inflammation or who have had oral surgery. The temperature obtained through the axillary method measures approximately 1 degree lower than the same person's temperature taken through the oral route. Highlight that sentence. The medical assistant should make a notation to tell the provider that the temperature was taken through the axillary route. Rectal temperature. The rectal temperature provides an extremely accurate measurement of body temperature because few factors can alter the result. Highlight that sentence. The rectum is highly vascular and of the 5 sites provides the most closed cavity. The temperature obtained by the rectal route measures approximately 1 degree Fahrenheit higher than the same person's temperature taken by the oral route. Highlight that sentence. The medical assistant should make a notation on the patient's chart if the temperature has been taken rectally. In general, the rectal method is used for infants and young children, unconscious patients, and mouth-breathing patients, and when greater accuracy in blood temperature is desired. The rectal site should not be used with newborns because of the danger of the rectal trauma. Oral temperature. The oral ear site is used when the tympanic membrane thermometer. Highlight that part. The ear provides a closed cavity that is easily accessible. Tympanic membrane thermometers provide instantaneous results, are easy to use, and are comfortable for the patient. They make it easier to measure the temperature of children younger than 6 years, uncooperative patients, and patients who are unable to have their temperatures taken orally. Highlight that part. Forehead temperature. The temporal artery is a major artery of the head that runs laterally across the forehead and down the side of the neck. Highlight that sentence. In the area of the forehead, it is located approximately 2 millimeters below the surface of the skin. Because of the temporal artery is located so close to the skin's surface and is easily accessible, highlight that, the forehead provides an ideal site for obtaining a body temperature measurement. In addition, the temporal artery has a constant, steady flow of blood, which assists in providing an accurate measurement of the patient's body's temperature. The forehead site can be used to measure body temperature using a temporal artery thermometer in individuals of all ages, newborns, infants, children, adults, and elderly. Highlight that sentence. The results compare in accuracy with other methods used to measure the body temperature. The temperature obtained from the forehead site is about the same as a rectal temperature measurement. The temporal artery reading measures approximately 1 degree higher than oral body temperature and 2 degrees higher than axillary temperature in the Fahrenheit scale. Any questions so far? All right. Lily, go ahead and read types of thermometers.
4 types of thermometers available to measure body temperature are electronic thermometers, tympanic membrane thermometers, temporal artery thermometers, and chemical thermometers. Mercury glass thermometers are no longer used in the medical office because they break easily and release mercury. Mercury is a chemical that is dangerous to the human body because it can cause damage to the nervous system. If mercury is released into the environment, it can be harmful to wildlife. Many cities have banned the sale or use of mercury because of its potential hazards.
Very good. Highlight electronic thermometers, tympanic membrane thermometers, temporal artery thermometers, and chemical thermometers. All right, Nancy, go ahead and read the first and second paragraph under the electronic thermometer.
An electronic thermometer is often used in the medical office to measure body temperature. Electronic thermometers are portable and measure oral, axillary, and rectal temperatures ranging from 84 Fahrenheit to 108 Fahrenheit, 28.9 Celsius to 42.2 Celsius. An electronic thermometer measures body temperatures in a brief time between 4 and 20 seconds, depending on the brand of thermometer used. The temperature results are digitally displayed on a liquid crystal dial screen. An electronic thermometer consists of interchangeable oral and rectal probes attached to a battery-operated portable unit. Figure 4.4. The probes are color-coded for ease in identifying them. The oral probe is color-coded with blue on its collar and is used to take oral and axillary temperatures. The rectal probe is color-coded with red on its collar and is used to take rectal temperatures only.
Very good. Highlight that the oral probe is color-coded with blue on its collar and is used to take oral and axillary temperatures, and the rectal probe is color-coded with red. All right, Natalie, go ahead and read the last paragraph, please.
A disposable plastic cover is placed over the probe to prevent the transmission of microorganisms among patients. Depending on the method of taking the temperature, the probe may be inserted into the mouth, axilla, or rectum and is left in place until an audible tone is emitted from the thermometer. When the tone sounds, the patient's temperature in degrees Fahrenheit is displayed on the screen. The medical assistant ejects the plastic probe cover into a regular waste container. The casing, probes, and attached cords of the electronic thermometer should be periodically cleaned with a soft cloth slightly dampened with a solution of warm water and disinfectant cleaner. Procedures 4.1, 4.2, and 4.3 outline the methods for measuring oral, axillary, and rectal temperatures using an electronic thermometer.
Very good, thank you. Okay, so you're going to highlight where it says a disposable plastic cover is placed over the probe to prevent the transmission of microorganisms among patients. And on figure 4.4, highlight where it says oral probe and rectal probe. Sabrina, can you go ahead and read the first paragraph under tympanic membrane thermometer?
The tympanic membrane thermometer is used at the oral site. The tympanic membrane thermometer functions by detecting thermal energy that is naturally radiated from the body. As with the rest of the body, the tympanic membrane gives off heat waves known as infrared waves. The tympanic thermometer functions like a camera by taking a picture of these infrared waves, which are considered a documented indicator of body temperature. The thermometer calculates the body temperature from the energy generated by the waves and converts it to an oral or rectal equivalent.
Very good. Talia, go ahead and read the next paragraph, please.
Tympanic membrane thermometer is battery operated and consists of a small handheld device with a sensor probe. To operate the thermometer, the probe is covered with a disposable soft plastic covering and is placed in the outer third or the external ear canal. The activation button is pressed momentarily and the results are displayed in 1 to 2 seconds on a digital screen. The probe cover is ejected into a regular waste container. Additionally, guidelines for using
Mm-hmm.
Tampax membrane thermometer are presented in box 4.1. The procedure for taking oral body temperatures using a tympanic membrane thermometer is presented in the procedure 4.4.
Awesome. Thank you. Okay, you guys are going to highlight where it says the tympanic membrane thermometer is battery operated and consists of small handheld device with a sensor probe, and highlight where it says a disposable soft plastic cover. All right, Alexis, go ahead and read the temporal artery thermometer.
Use of the temporal artery thermometer is the newest method for assessing body temperature. A temporal artery thermometer is an electronic device consisting of a probe attached to a portable unit. Figure 4.7.
All right. So on page 93, under the temporal artery thermometer, go and highlight that it's the newest method for assessing body temperature. On page 94, under 6, highlight where it says fingerprints, serum, and dust reduce the transparency of the lens, resulting in a falsely low temperature readings. On number 8, under the probe lens, highlight where it says clean the lens, gently wipe its surface with an antiseptic wipe, and immediately wipe it dry with a cotton swab. Under the thermometer casing, highlight clean the casing of the thermometer periodically by wiping it dry with a soft cloth slightly moistened with alcohol.
What was the last thing you said?
Thermometer casing on 94 under 8. Highlight that first sentence.
I missed the one before fingerprints and the cerumen.
Okay, on 93, under temporal artery thermometer, highlight that it's the newest method for assessing body temperature.
Thank you.
You're welcome. All right, Alicia, go ahead and read the next paragraph on 95.
To perform the procedure, a scan button is continually depressed while the probe is gently and slowly moved across the patient's forehead. During this process, the probe sensor scans the forehead for the infrared heat given off the temporal artery. The probe sensor captures the highest temperature or peak temperature in the area being scanned. The peak temperature represents the temperature given off by the temporal artery or body temperature.
Very good. Highlight where it says the probe sensor captures the highest temperature or peak temperature. Anna, go ahead and read the next paragraph, please.
Along with measuring the peak temperature, the probe sensor automatically measures the abundant temperature, which is the surrounding air temperature. This is done because there is a small heat loss from the forehead that occurs as a result of cooling by abundant temperatures. The thermometer's computer determines and automatically corrects for any effects from the abundant temperature. An accurate body temperature reading is digitally displayed on the screen on the thermometer. The procedure for measuring temperatures with a temporal artery thermometer is presented in procedure 4.5.
All right, very good. So on the last paragraph, I just want you to highlight where it says an ambient temperature. Danae, will you please read the first and second paragraph under earlobe temperature measurement?
Sweating of the forehead can cause an inaccurate temporal artery temperature reading. This is because perspiration causes the skin of the forehead to cool, resulting in a falsely low temperature reading. Sweating of the forehead occurs when a patient's fever breaks. It also occurs when a patient's skin is clammy. In this instant, forehead sweating may be present but not readily visible. To avoid this problem, the temperature of the neck area located just behind the earlobe also must be measured.
Very good.
You said the second paragraph too, or?
Yes, go ahead and read the second
Okay.
paragraph.
The area behind the earlobe is less affected by sweating than the forehead. During sweating, the blood vessels behind the earlobe dilate, resulting in a constant, steady flow of blood, which provides an accurate measurement of the body temperature. After scanning the forehead, the medical assistant must place the probe of the thermometer in the soft depression of the neck just below the mastoid process of the ear. If the patient's forehead has cooled from sweating, the earlobe temperature automatically registers as the peak temperature, thereby overriding the forehead temperature.
All right, very good. Thank you. Okay, so I want you guys to highlight the first sentence under earlobe temperature measurement and highlight the last sentence on that first paragraph. And then I also, on box 4.2, you're going to highlight under 4, the third bullet point. The area behind the earlobe does not normally provide an accurate body temperature measurement and supersedes the forehead measurement only when the patient is in a diaphoretic state. Additional guidelines for the temporary artery temperature measurement are presented in box 4.2. Care and maintenance. The temporal artery thermometer should be stored in a clean, dry area. The thermometer must be protected from extremes in temperature, direct sunlight, and dust. The casing of the thermometer should be cleaned periodically with a soft cloth moistened with a solution of warm water and a disinfectant cleaner. Never splash water on or immerse the unit in water because this could damage the internal components of the thermometer. To obtain an accurate measurement, the probe lens must be clean and shiny. Dust and other minute particles of environmental debris can build up on the probe lens during the normal use, preventing the probe sensor from getting an accurate view of the heat emitted by the temporal artery and resulting in a falsely low reading. The lens should be cleaned if it becomes dirty and as part of a routine maintenance. The lens is cleaned by gently wiping its surface with an antiseptic wipe and immediately wiping it dry with a cotton tip applicator stick. You guys are going to highlight on that second paragraph where it says preventing the probe sensor from getting an accurate view of the heat emitted by the temporal artery and resulting in a falsely low reading. And also highlight where lens is cleaned by gently wiping its surface with an antiseptic wipe. Chemical thermometers. Chemical thermometers contain chemicals that are heat sensitive and include disposable chemical single-use thermometers and temperature-sensitive strips. They are used most often by patients at home to measure body temperature. Although chemical thermometers are less accurate than other types of thermometers, they assist in providing a general assessment of body temperature. Highlight the next sentence. Because of their chemical makeup, they should be stored in a cool area, preferably colder than 86 degrees Fahrenheit, and should not be exposed to direct sunlight because heat may cause the thermometer to register a higher temperature. Each type of chemical thermometer is described here. Disposable chemical single-use thermometers. The disposable chemical single-use thermometer has a small chemical dots at one end that respond to body heat by changing color. Each thermometer comes in its own wrapper. The protective wrapper must be peeled back to expose the handle of the thermometer. The thermometer is removed from the wrapper by pulling on the handle, taking care not to touch the dotted area. The thermometer is inserted under the tongue and is left in place for the duration of time recommended by the manufacturer, usually 60 seconds. After removal of thermometer, the dots are observed for a color change or for a change in color. The thermometer is read by noting the highest reading among the dots that have changed color. The thermometer is discarded after use. Temperature-sensitive strips. A temperature-sensitive strip consists of a reusable plastic strip that contains heat-sensitive liquid crystals designed to measure body temperature. The plastic strip is pressed onto the forehead and held in place until the colors stop changing, usually for 15 seconds. The results are read by observing the color change and noting the corresponding temperature indicated on the strip. Okay, I want you guys to go on over to page 101. Okay, I want you to highlight the principle under number 5, procedural step. And on number 6, procedural step, you will highlight where it says 1 inch into the rectum of an adult, 5/8 inch in children, and 1/2 inch in infants. And then we're going to go on over to page 107.
What was the first one?
The principle on the number 5 procedural step on page 101.
Okay, thank you.
You're welcome. All right, any questions about anything of that so far? All right, very good. So now we're going to start getting into pulses. Pulse, mechanism of the pulse. When the left ventricle of the heart contracts, blood is forced from the heart into the aorta, which is the major trunk of the atrial system of the body. The aorta is already filled with blood and must expand to accept the blood being pushed out of the left ventricle. This creates a pulsating wave that travels from the aorta through the walls of the atrial system. This wave, known as the pulse, can be felt as a light tap by an examiner. The pulse rate is measured by counting the number of taps or beats per minute. The heart rate can be determined by taking the pulse rate. Factors affecting pulse rate. Pulse rate can vary depending on many factors. The medical assistant should take each of the following into consideration when measuring a pulse. You will highlight 1, 2, 3, 4, 5, 6, and 7. Number 1, the age. The pulse varies immensely with age. As age increases, the pulse rate gradually decreases. Table 4.4 lists the pulse rates of various age groups. Number 2, gender. Women tend to have a slightly faster pulse rate than men. Number 3, physical activity. Physical activity such as jogging and swimming increases the pulse rate temporarily. Number 4, on emotional states. Strong emotional states such as anxiety, fear, excitement, and anger temporarily increase the pulse rate. Metabolism. Increased body metabolism, such as occurs during pregnancy, increases the pulse rate. Number 6, fever increases the pulse rate. And number 7, medications. Medications may alter the pulse rate. For example, Digitalis decreases the pulse rate and epinephrine increases it. All right, case study number 1. Marcella Mason comes in with Olivia, her 5-year-old daughter. Olivia has a fever and a sore throat for the past 2 days. Olivia's oral temperature is taken in her left ear, and it measures 103.3 degrees Fahrenheit. Mrs. Mason says that she has an ear thermometer at home, but when she took Olivia's temperature with it, the readings were always below 97 degrees. She knew that could not be right because Olivia felt so warm. Miss Mason would like to be able to use her ear thermometer, but she thinks that it might be broken because of the low readings. Miss Mason says that she is thinking of switching back to a mercury glass thermometer, but she has heard that it isn't a good idea to use this type of thermometer anymore and wants to know why. Okay, so the first part is, what would you do?
You would ask her when was the last time she cleaned her thermometer.
Okay. Good.
Explain to her why the mercury glass thermometer isn't used or isn't
Right.
such a good idea to use.
That's right. Very good. All right. What else could we do?
Show her how to use the thermometer. Maybe she doesn't know how to use it right.
Yeah, we could. So what would be a way that we could tell her that, how would we instruct our patient to use the ear thermometer? Do they just stick the probe just like right in the ear, or do they have to make sure they get a good closed area?
Close.
Closed. That's right. Very good. All right. Well, what's a couple of things that we know with even just the ear thermometers that if the patient's not doing, it can cause a false low reading?
If it's dirty,
Yes. Very good.
the daughter's moving around.
Yeah. Very good. Okay, good. All right, so now let's switch it over. What do we not want to do?
We don't want to automatically tell her, oh, your thermometer isn't working, or that she was wrong, I guess.
Right. Yeah. We don't want to send her home and just tell her, well, I don't know what you need to do. Read your instructions. No, we want to be able to kind of walk her through it. Another thing that we don't want to do is what? We said it a while ago when we were talking about just a minute ago about the mercury.
I'll give her the explanation as for why we don't use the mercury.
Right. Yeah. Yeah. So we want to just remind her, we don't want to tell her that it's okay to use the mercury thermometer. We want to tell her that, it's not a good idea to use it, and this is why. We want to make sure we give her the information she's going to need. All right. Very good. Okay. So pulse site. The pulse is felt most strongly when the superficial artery is held against a firm tissue such as bone. The location sites used for measuring the pulse are shown in figure 4.10 and are described next. So highlight the first sentence under pulse sites. And let's quickly look at the figure 4.10. So this morning I told you guys that there are two common areas that a person will check their pulse. Looking at figure 4.10, what would be the name of those pulse sites?
The carotid and the radial.
Very good. Yes. Good. Now, this diagram right here is in your clinic folder. I would suggest y'all study it. All right, radial. The most common site for measuring the pulse is the radial artery, which is located in a groove on the inner aspect of the wrist just below the thumb. Highlight that sentence. The radial pulse is easily accessible and can be measured with no discomfort to the patient. This site is also used by individuals at home monitoring their own heart rate, such as athletes, patients taking heart medication, and individuals starting an exercise program. The procedure for measuring radial pulse is outlined in procedure 4.6. Apical. The apical pulse has a stronger beat and is easier to measure than the other pulse sites. If the medical assistant is having difficulty feeling the radial pulse, or if the radial pulse is irregular or abnormally slow or rapid, the apical pulse should be taken. This pulse site is often used to measure the pulse in infants and in children up to 3 years of old because the other sites are difficult to palpate accurately in these age groups. The apical pulse is measured using a stethoscope. The chest piece of the stethoscope is placed lightly over the apex of the heart, which is located in the fifth intercostal between the ribs space at the junctions of the left midclavicular line. So you're going to highlight that very last sentence. All right, let's see here. Jasmine, go ahead and read that next paragraph, please, under brachial.
The brachial pulse is the antecubital space, which is the space located at the front of the elbow. This site is used to take blood pressure, to measure pulse in infants during cardiac arrest, and to assess the status of circulation to the lower arm.
Very good. You're going to highlight the very first sentence. Lily, go ahead and read ulnar.
The ulnar pulse is located on the ulnar, little finger, side of the wrist. It is used to access the status of circulation to the hand.
Very good. Highlight that first sentence. Nancy, go ahead and read temporal.
The temporal pulse is located in the front of the ear and just above the eye level. This site is used to measure pulse when the radial pulse is inaccessible. It is also an easy access site to access pulse in children.
Very good. Natalie, go ahead and read carotid.
Which one?
Carotid, please.
I'm lost. I was talking with Ms. Lupe.
Page 108.
Hmm.
Read the paragraph under the carotid.
Oh, okay. The carotid pulse is located on the anterior side of the neck, slightly to one side of the midline, and is the best site to find a pulse quickly. This site is used to measure pulse in children and adults during cardiac arrest. The carotid site also is commonly used by individuals to monitor pulse during exercise.
All right, very good. Sabrina, please read the next one.
Femoral. The femoral pulse is in the middle of the groin. This site is used to measure pulse in infants and children and adults during cardiac arrest and to assess the status of circulation to the lower leg.
Very good. Highlight the first sentence. Talia, go ahead and read the next paragraph, please.
The popliteal pulse is at the back of the knee and it is detected most easily when the knee is slightly flexed. This site is used to measure blood pressure when the bronchial pulse is inaccessible and to assess the status of circulation to the lower leg.
Very good. Highlight the first sentence. All right, Alexis, go ahead and read the next paragraph.
Is it the popliteal?
The posterior tibula.
Well, the posterior tibula pulse is located on the inner aspect of the ankle just posterior to the ankle bone. This site is used to access the status of circulation on the foot.
Very good. Highlight the last sentence. All right, Alicia, go ahead and finish with the last paragraph, please.
The dorsalis pedis pulse is located at the upper surface of the foot between the first and second metatarsal bones. This site is used to assess the status of the circulation to the foot.
Very good. Highlight the first sentence. All right, Anastasia, go ahead and read the assessment of pulse, those two paragraphs.
The purpose of measuring pulse is to establish the patient's baseline pulse rate and to assess the pulse rate after special procedures, medication, or disease processes that affect heart functionings. Pulse is measured using populations at all of the pulse sites except the apical site. Pulses is calculated by applying moderate pressure with the sensitive pads located on the tip of the three middle fingers. The pulse should not be taken with the thumb because the thumb has a pulse of its own. This can result in measurements of the medical assistant's pulse rather than the patient pulse.
All right, very
So,
good.
I wasn't done.
That's okay. Go ahead.
Excessive pressure should not be applied when measuring pulse because this could be obliterated or close off close off the pulse. It may not be possible to detect the pulse if too little pressure is applied. However, an acute assessment of pulse includes determination of the pulse rate, the pulse rhythm, and the pulse volume.
Very good. Okay, so on the first paragraph, you're just going to highlight that very first sentence. All right, Jasmine, go ahead and read pulse rate.
Just the first paragraph or the whole thing?
The whole thing.
Okay. The pulse rate is the number of heart pulsations. That's how you say that?
Pulsations, yes.
Okay. Pulsations or heartbeats that occur in 1 minute. Therefore, pulse rate is measured in beats per minute. Normal pulse rates vary widely in the various age groups as shown in table 4.4. For a healthy adult, the normal resting pulse rate ranges from 60 to 100 beats per minute, with the average falling between 70 and 80 beats per minute. An abnormally fast heart rate of more than 100 beats per minute is known as how would you say it?
Tachycardia.
Tachycardia. Tachycardia may indicate disease states such as hemorrhaging or heart disease. Tachycardia usually occurs when an individual is involved in vigorous physical exercise or experiencing strong emotional states. Bradycardia is an abnormally slow heart rate less than 60 beats per minute. A pulse rate of less than 60 beats per minute may occur normally during sleep. Trained athletes often have low pulse rates. If a patient exhibits tachycardia or bradycardia during radial pulse measurement, the apical pulse should be measured.
All right, very good. Thank you, Jasmine. Okay, so I want you to highlight the first sentence. Sorry, guys. The first sentence on the first paragraph. Highlight that the normal resting pulse rate ranges from 60 to 100. Highlight the first sentence in the second paragraph and the first sentence in the third paragraph. So if I were to tell you that my normal pulse rate is 140, do I have bradycardia or tachycardia?
Tachycardia.
That's right. In which I do. If a patient has a pulse of 45, what would that be called? Bradycardia. That's right. Very good. All right. Any questions about any of this so far? All right. Lily, go ahead and read the first two paragraphs under pulse, rhythm, and volume.
In addition to measuring the pulse rate, the medical assistant should determine the rhythm and volume of the pulse. The pulse rhythm denotes the time interval between heartbeats. A normal rhythm has the same time interval between beats. Any irregularity in the heart's rhythm is known as
Dysrhythmia.
and is characterized by unequal or irregular intervals between the heartbeats. If a dysrhythmia is present, the provider may order one or more of the following: an apical radial pulse, an electrocardiogram, or a Holter monitor.
Very good.
An apical radial pulse is measured to determine whether a pulse deficient is present. Taking an apical radial pulse involves measuring the apical pulse at the same time as the radial pulse for a duration of 1 full minute. A pulse deficient exists when the radial pulse rate is less than the apical pulse rate. If one medical assistant measures an apical pulse rate of 88 beats per minute, while another medical assistant simultaneously measures a radial pulse rate of 76 beats per minute, this results in a pulse deficient of 12 beats. A pulse deficient means that not all of the heart beats are reaching the peripheral arteries.
Very
A
good.
pulse deficient is caused by a inefficient contraction of the heart that is not strong enough to transmit a pulse wave to the peripheral pulse site. A pulse deficient frequently offers with arterial fibrillation, which is a type of dyspnea.
Very good. All right, see, I told you we were going to start getting some trickier words, right? Okay, so on the first paragraph, you're going to highlight where it says the pulse rhythm denotes the time interval between heartbeats. Highlight a normal rhythm has the same time interval between beats. Highlight the words dysarrhythmia and arrhythmia.
Mike.
In the second paragraph, highlight the first sentence. An apical radial pulse is measured to determine whether a pulse deficit is present.
Mike.
Also highlight where it says a pulse deficit exists when the radial pulse rate is less than the apical pulse rate. The pulse volume refers to the strength of the heartbeat. Highlight that sentence. The amount of blood pumped into the aorta by each contraction of the left ventricle should remain constant, making the pulse feel strong and full. If the blood volume decreases, the pulse feels weak and may be difficult to detect. The type of pulse is usually accompanied by a fast heart rate and is described as a thready pulse. An increase in the blood volume results in a pulse that feels extremely strong and full, known as a bounding pulse. So highlight that first sentence on the third paragraph. Highlight where it says pulse feels weak. Highlight where it says described as a thready pulse. And highlight where it says strong and full and known as a bounding pulse. Okay, so I want everyone to get their binder out and turn to your tab where it says chapter 4. Okay, so for homework, you are going to do the blood pressure review. The conversion sheet under that tab.
You said the blood pressure review?
Yes.
I don't think
It looks like this.
Yeah, I don't have that.
I don't have that either.
I don't either.
Me either.
Well,
Me-
crapola. Okay, do you guys have the chapter 4 conversion?
Yes.
Okay, so do that one. And then what I want you to do is you're going to take a sheet of paper and I want you to mimic the meter on your blood pressure cuff, okay? So you'll just kind of either trace it or draw it. And then I want you to write numbers 1, 2, 3, 4, and 5. Number 1 is going to be 110 over 70. Number 2, 120 over 64. Number
Start over.
three,
I'm sorry.
it's okay. Go ahead. What's your question?
Can you just start over with number 1?
Yes. So number 1
Okay.
is 110 over 70. Number 2 is 120 over 64. Number 3 is 102 over 58. Number 4 is 130 over 72. And number 5, 100 over 68. Okay, so you'll in total draw 4 blood pressure meters, and then you're going to mark with a pen where you would find 110 over 70 on the meter. Does that make sense?
So you said we're supposed to pretty much show on the meter what, like, okay.
Yeah. So like if I say it's 110 over 70, I want you to mark that on the meter where the 110 to 70 would be. And then you will scan it and email that to me, and the chapter 4 conversion for the temperatures.
That by.
The what?
When do you need it by? Tonight?
It's homework, so we will. So by tomorrow morning.
Okay.
I'll give y'all time to do that. All right. Any questions about anything so far? All right. Alicia, please tell me what is on today's agenda for Evolve.
We have the chapter 3 test, the chapter 4 apply your knowledge, and chapter 4 video evaluation, 5 vital signs a day, the study guide 99 through 110, I believe. I don't have it on right now. I'm just going off what I remember. And then review chapter 5. And is that right? I don't have it with me, but
Yeah, that sounds about right. All right, good. Okay. So then on top of that, then you'll do the 2 worksheets, but we will grade, they're not due until tomorrow morning. Has everyone been able to submit their resume to Miss Loopy?
Yes.
I did. Yeah.
Good.
Yes.
Good. Okay. So the CPR, really quickly before we go any further. So those of you, I know those of you that have told me that you've watched the CPR. But apparently, because not many people did watch the CPR, that there was no, I mean, you guys are going to have to wait till August to take your CPR certification now. And for those of you that did not watch it, there is absolutely no reason that it should not have been watched. So that was quite disappointing this morning. Okay. All right. So page 109, respiration mechanism of respiration. The purpose of respiration is to provide for the exchange of oxygen and carbon dioxide between the atmosphere and the blood. Oxygen is taken into the body to be used for vital body processes, and carbon dioxide is given off as a waste product. Each respiration is divided in two phases, inhalation and exhalation. Highlight that sentence. During inhalation or inspiration, the diaphragm descends and the lungs expand, causing air containing oxygen to move from the atmosphere into the lungs. Exhalation or expiration involves the removal of carbon dioxide from the body. Highlight that sentence. The diaphragm ascends and the lungs return to their original state so that air containing carbon dioxide is expelled. One complete respiration is composed of one halation and one exhalation. Respiration can be classified as external or internal. External respiration involves the exchange of oxygen and carbon dioxide between the alveoli, thin-walled sacs of the lungs, and the blood. The blood located in small capillaries comes in contact with the alveoli, picks up oxygen, and carries into the cells of the body. At this point, the oxygen is given off to the cells and carbon dioxide is picked up by the blood to be transported as a waste product to the lungs. The exchange of oxygen and carbon dioxide between the body cells and the blood is known as internal respiration. Highlight that last sentence. Okay, so since most of you guys are going to have a boost class at 4, we will stop there, which means you guys are going to be responsible for watching the YouTube channels to make sure that you get the remainder of the chapter highlighted, reading the chapter, and making sure that you read over the figures, the tables, the procedures, the terminology review, and the case studies in the chapter. If you have not already, send me the Chapter 3 study guide questions. Please do so. And then we will start in Chapter 5 tomorrow. Does anyone have any questions?